In this video, I'm going to highlight the changes that were made to the clinical summary. There are two ways to produce the clinical summary. You can either click the Export button, or you could go to Chart, Export, Patient Data. Remember, the Export button should only be used if it is the day of the patient's office visit. If it is a day other than their office visit, you should use the option through the Chart menu. This was important in Stage 1 since you had 3 business days to generate the clinical summary. However, in Stage 2, this will not be as important since you only have 1 day to generate the clinical summary in order to receive credit. I will demo the process today using the Chart menu method since there are some new options available through there. To access clinical summaries, click Chart, Export, Patient Data. Clinical Summary will be the default option in the Document to Export dropdown. Towards the bottom of this dialog, you will see 2 new options, Previous Summaries and Preferences. After you click Previous Summaries, you will receive a dialog listing previously generated summaries for this patient with the date, time, and user who generated it, as well as an option to reprint them if necessary. The Preferences dialog will give you the option to display or hide the exclusion dialog when printing a clinical summary. The exclusion dialog is a new feature in 5.1. When you attempt to print the clinical summary, as long as you have the option to display the exclusion dialog turned on here, you will be prompted with a window allowing you to select items that you do not want to include on your clinical summary. If you think that you will never want to exclude information, and/or if you do not want to be prompted, then uncheck Display Exclusions dialog when exporting clinical summary. If that box is not checked, you will not receive the exclusion dialog when printing a clinical summary. The option for Display Exclusions dialog for all patient portal patients when note is signed will only be applicable for registered patients. In 5.1, we've added the feature of automatically sending the clinical summary to the patient portal upon note signing. This is a great feature since you will receive credit for the clinical summary measure without physically printing the clinical summary. This feature is only applicable if the patient is registered on the patient portal. If you are in a patient's chart that is not registered, you will still need to physically print the clinical summary in order to receive credit for that measure. So this second preference to display the exclusion dialog is saying that you want to receive the exclusion dialog whenever signing a note in a patient's chart who is registered for the patient portal. This will give you the option to exclude information from being displayed on the clinical summary that will end up going directly to the patient portal. I will leave both of these checked so that I can show you what happens in both of those situations. These preferences will be turned on by default. These 2 options are user-level preferences, meaning each user will have the option to set their preference. Now that we've set our preferences, let's generate a clinical summary. You will receive the exclusion dialog after clicking either Print or Save. This is the new exclusion dialog that you will receive when you print a clinical summary or sign your note in a patient's chart who is registered on the patient portal. From within here, you can select the items that you do not want to print on the clinical summary. If you would like everything to print on the clinical summary, then do not select anything from here, just click OK. There may be a delay after you click OK. Do not click Print again, just wait for the screen to close. Now let me show you that the same thing will happen when I attempt to sign this note since this patient is a registered patient portal user. I know that they are registered because the patient portal button at the bottom of the screen is green. When I click Sign, I will receive the exclusion dialog. Again, if I would like to exclude some of this information from being printed on the clinical summary that goes to the patient portal, I can click the boxes next to those items before clicking OK. If I do not select any of those items, everything will be printed on the clinical summary. Please keep in mind that in a normal example, you most likely would not have manually exported the clinical summary first for this patient, since it would be extra steps and duplication of effort. I showed you both steps in this patient's chart for demo purposes only. If you are in a chart and the patient portal button is green, keep in mind that all you need to do is sign the note and the clinical summary will be sent to the patient portal, giving you credit for that measure. If the patient portal button is not green, then you will need to manually generate the clinical summary in order to receive credit for the measure. Under the Note menu, you will see the option for Edit Clinical Summary and Sign. This option will only be available if the preference to display the exclusion dialog for patient portal users is turned off. This is the second checkbox that we saw earlier on the Preferences dialog. If that box is unchecked, meaning that in general you do not want to receive the exclusion dialog when signing a note, then this option will be available. You would select this option before signing your note. After clicking this option, you would receive the exclusion dialog. One last addition related to clinical summaries is the option to still receive credit for the measure if a patient decides they do not want to receive a clinical summary. If your patient declines the clinical summary, go to Chart, Export, Patient Declined Clinical Summary. By selecting this option, you will receive credit for the clinical summary measure while also satisfying the patient's desire not to receive it.